Francis Ontoma painting a rather grim picture of Kenya's strategy when it comes to the fight against cancer in the country. Let's talk about this right now on the show. I'm joined by the Secretary General of the Kenya Medical Practitioners and Dentists Union, Dr. Ouma Oluga. Thank you very much for joining us. You've just watched that piece, some grim statistics. The National Cancer Institute to date has just one employee, no officers. Paint for us the picture of what's happening in this country.
So, thank you very much, Yvonne, for this invite. Indeed, today is World Cancer Day, and I think the significance KTN has given to this is appreciated. First is to let me take a few minutes also to just congratulate the doctors at Kenyatta National Hospital, Professor Hainga and group, that put back an amputated hand for boy, and the doctors along the chain from Kiambu, you know, who made the decisions that led to the right treatment. I think we appreciate that work. Sometimes you celebrate little successes, and then you get big. And then secondly, also related to this whole cancer problem is that many patients struggle with cancer treatment, but sometimes even at the hospitals you find that you're supposed to have radiotherapy or chemotherapy, but the blood is lacking. So you're told that wait, get relatives for blood donation. So the KMPDU, our union, has partnered with the Kenya National Blood Transfusion Services for a blood donation drive on Wednesday, the 14th, which is also Valentine's Day.
Yes, that's
so
right.
It's dubbed Show Your Love. So we are appealing to the public to come up in large numbers. It will be countrywide in 22 sites, the whole country. At KICC, it will be between 6 a.m. and 10 a.m. And we want to appeal to people to come out so that this week at least and the next weeks, this month, which is a Cancer Awareness Month, someone that needs chemotherapy or radiotherapy should not miss it because they don't have blood. So that one we are doing, and we are very grateful also for the support that we've gotten. So going to this story, the problem with the cancer management and the cancer strategy is the problem that we have in the health sector. So, and I'll just break it down into two key issues. Number one is access, and number two is cost. So access in terms of you don't have access to screening. When you get access to screening, you may not have access to the diagnosis. And then if you get access to diagnosis, you may not have access to treatment. And there are a number of things that cause these barriers to access. Of course, awareness is a problem, but that's not the biggest problem. The biggest problem, I think, are two. One is the human capacity, the human resource, the qualified personnel and the specialists that are able to screen cancer, to diagnose cancer, and to treat cancer. And then secondly, even when you can be able to treat it, then you need equipment to do that. Sometimes you need radiotherapy machines. Some of them cost up to 200 million. Sometimes you need very expensive medicines. We call them chemotherapy. And so that there's barriers to those access. I think if we sort out the issues of the personnel, you know, and this is what some of the things we were talking about last year.
Yes, exactly. Because Francis has talked about just 23 oncologists in the country to serve the entire population.
And
these are some of the things you talked about.
And I've seen Andrew. Before Andrew came back, there were just 22. And nearly all of them are in Nairobi. And in 2013, the government had committed to do 4 cancer centers in Nyeri, in Coast General, in Kisumu, the Jaramogi Oginga Odinga Hospital, and then at MTRH. You've just seen the one for MTRH just remains a room. Nothing is going on there. I think a lot of resources have been put in there, but it's not been turned into function because, again, you need more investment, but more importantly, you need people. You need people with the skills to do these things.
Let me ask you this. With respect to, because health is now a devolved function, the president, has made certain commitments to that. Do you think there's a proper coordination with what's happening at the national and the county level? Equipment is purchased that will be then managed by the counties. Where's the disconnect?
There's a very big disconnect in terms of how we are managing our how we are managing our healthcare and the problem is actually coordination, as you said. So stakeholder involvement is not there. Proper financing schemes are not there. And even I wanted to come to the issue of the cancer centers, because last year, when the government was doing, again, a national cancer control strategy, 2017-2022, they came up and then, of course, they reshuffled those centers, like they took another one to Kisii. I don't know why Kisumu was not chosen. But then, again, you find that they're saying that they'll do a private-public partnership. Basically, the good name for a private-public partnership project in Kenya is tender. So it causes another barrier where we may spend a lot of resources, and then the people who really deserve these services are not going to get them. So, and cancer now is the #3 disease killer in this country, after infectious diseases and cardiovascular. So it's something that I think the whole problem of the whole health sector, you know, which is access, which is financing,
is manifesting itself.
It's manifesting itself in cancer. And then I think every time we look at a problem in Kenya, we are looking at either a law, like creating the National Cancer Institute. You know, so when we have a problem, we either run to the law or we run to the private sector. And the private sector is purely driven by profit. The ladies who come from Coast or Taita or Nyeri or travel from Isibania to Kenyatta National Hospital spend more money on transport than on the medicine that they're supposed to buy.
Okay, hold that thought, because you're talking about what happens for those who have to make that journey.